The Ebola crisis is throwing up lots of interesting options for the world when it comes to dealing with medical crises. Technology comes to the fore, leadership comes to the fore as well. But there are people working in the healthcare sector who we don't hear very much about. And without them, thousands of lives would be lost. At a drop of a hat, they fly to places that others fear to tread in. This is Tonight. I'm Bruce Whitfield. Tonight we talk about Médecins Sans Frontières' role in combating Ebola and the Tough Decisions campaign. Joining me, Dr. Mohammed Dalwai and Patten, who joins us from Médecins Sans Frontières. She works in Khayelitsha at the moment. Mohammed Dalwai, nice to have you with us in Cape Town this evening, along with Patten. Give me a sense, please, of looking at this Ebola crisis as probably the biggest global health threat that we've seen since the days of bird flu and the concerns around those particular viruses from Asia, and the impact it's having on health perceptions around the world.
Thank you so much for having us, Bruce. I think you're right. I think it's one of the biggest crises that we are facing now at the moment. And it's one of the largest Ebola crises that we've ever faced in the history of MSF. And we're really looking to try and improve the way people see MSF and what the work we do, and try and make it more real for South Africa and for South African citizens.
I mean, we've seen the charity work of many charitable organizations around the world. Médecins Sans Frontières is French-based, of course, but is a global organization. How are you being utilized in the battle against Ebola?
So MSF has a MSF Southern African office, which includes many countries within Sub-Saharan Africa. And what we are trying to do is help the global movement by providing human resources such as doctors, epidemiologists, nurses, to go help in the Ebola-stricken countries, as well as raising awareness around what is happening in West Africa at the moment and how we, as normal individuals around the country, can actually help out in what's happening at the moment. How
good is the communication around Ebola? We see the hype, we see the threats, we see it becoming a global story because there have been a couple of cases in the United States of America. It almost seems as if an African problem is an African problem unless it becomes somebody else's.
I think it's important to realize that we need to have sustained coverage on Ebola and topics like Ebola, and we need to actually galvanize ourselves as a community in Africa as well as an international community to look at how we can truly help what's happening in West Africa, because it's not only an African problem. It's an infectious disease. This thing can spread, and we've seen proof of how this has spread throughout the world. America is one example. And if we don't come together as an international community and actually form a coalition that can make a big difference and kind of break the epidemic, we will see ourselves in a bit of a bigger crisis at the moment. And we need to focus and constantly kind of highlight the issues of what's happening in West Africa and the people that are on the ground in West Africa and the patients that are unfortunately dying, and highlight their plight and highlight their stories and say we need to come together and help them.
With Mohammed Dalwai in Cape Town is Patten. You make big requests of people when you say to them, we know that there is one of the most infectious diseases known to man in the world today. There's an outbreak in West Africa. We need you to go there and help people. Médecins Sans Frontières, of course, has never shied away from a medical crisis in its existence, but it's got to be pretty tough in a world, an interconnected world where communication is as good as it is, where people know the risks the way they know those risks. How do you deal with it?
Yeah, it was quite a tough decision to actually decide to go. I'm normally based here in Cape Town. I work on HIV. And Ebola, a disease, is worlds away from what I do. And working on an outbreak is also quite different to what I normally do. So it's worlds away. But, you know, as soon as it looked like the epidemic was really spreading in June and July, it seemed like there was such a need, and there's such a huge need for all sorts of healthcare workers, doctors, nurses, and epidemiologists to really try to address what's happening in West Africa. And there's still a huge need. We really are we really are struggling to get ahead of the epidemic there.
Is one of the biggest constraints, Jim, a lack of, I don't know, coordinated leadership on this? Well, one sees the United States throwing money at it. One sees some tech entrepreneurs throwing money at the issue. One doesn't hear too much publicly anyway from the African Union on this. One doesn't get a sense that this is being led very strongly within the African continent. Is my impression wrong?
I think a coordinated effort is really key to trying to get ahead of this epidemic. We have such a shortage of really simple things like ambulances, even like guaranteed supply chain of all the equipment and the necessary infection control supplies like chlorine. Those all need to be put in place. We need more treatment centers. We need better and bigger lab capacity. If we want to get ahead, we also need to work really closely with the Sierra Leone government and the other governments in the other countries to improve their surveillance systems and their contact tracing systems. So I couldn't agree more that really a coordinated effort is essential. And whether it's the African Union getting involved, we'd still need a sort of global governing body trying to coordinate all efforts from the many countries who've promised resources.
Mohammed, is this a job for the United Nations? Is it doing an effective leadership role in combating the crisis?
Well, I mean, I don't think it's really for us to comment on who's doing the best work.
Who would you like to see take control? Who would you like to see drive the process?
Well, I mean, I think it's a coordinated approach. I think it's not just one body doing everything. We've been calling on the international community to have a coalition of people working together to really make a difference here. And that doesn't involve just one body and naming and shaming. It involves the UN, it involves the WHO, it involves the national governments of each country, and it involves sometimes the private sector. So it's not just one body's problem, but it's a coordinated approach that one body could lead, such as, for the national governments could lead it, and then they can call on international organizations to help them. And I think it's not about the naming and shaming, it's about improving the system of how we have a coordinated approach and how we come together as an international community to do this.
Somebody needs to be in charge, Mohammed. Who should be?
I know, you put me on the spot there, Bruce. Thank you so much for that.
That's the job, Mohammed. That's the job.
I mean, I definitely think that MSF should not be in charge. It's a private, independent organization, and this should be coordinated by national governments. And the help can come in from the WHO and from the UN. So I think it is a national-led coalition that we need to look at. I don't know, Jim, do you have
That's called passing the buck, Mohammed. That's called passing the buck. But the real issue here,
thanks for picking it up, Bruce.
No, absolutely, subtle that way, Mohammed. Are national governments, on a more serious note, Jim, are they adequately prepared for what is happening on the ground in their own countries, or do they need this external assistance?
I can only speak from my experience in Sierra Leone, and I think absolutely Sierra Leone needs all the help that they can get. The government, they really are trying their best. I worked quite closely with the Department of Health there, their surveillance officers and their contact tracing team. But really they need us. They need all NGOs and international support. They just don't have the capacity to deal with such an outbreak, and they've never done it before. So people with experience of any kind of outbreak can help. And I think they really have to accept help from outside.
It feels like the Ebola crisis is not controlled, but it may be largely contained. How's that as an assessment?
Yeah, I think as with any emergency situation, it's ever changing. So for the moment, we can say it seems that the world has kind of successfully contained it to West Africa, with one or two other cases coming now in the US and Spain. So perhaps at the moment it's contained, and some of the measures that have been put in place to contain it must have been working. So that's one positive. But within the countries itself, Sierra Leone, From my experience, recently it's now appeared in every district across the country, whereas before it was only isolated to the eastern part of the country where I was based.
When you look at the scenario of hope for containing and dealing with Ebola, do you have that scenario sketched out in your head?
I think the traditional way of controlling an epidemic is really to be quite proactive and do very stringent contact tracing. So that means making sure that everyone who was a contact of a confirmed case is traced and followed for 21 days rigorously to make sure that they don't develop symptoms. And if any contacts do develop symptoms, then they are quickly isolated in treatment centers. And at the moment, our treatment centers are at capacity. So it's quite hard to be proactive in containing the epidemic and trying to break the transmission chains. So we really are falling a little bit behind, especially with the news in Sierra Leone that in the western side of the country, the northern sections, there's an upsurge in cases in the bigger cities. So I think we have a lot to do to contain it. But I do think it's quite simple, an approach really to contain it. We need more treatment centers and we need better surveillance and contact tracing methods.
Mohammed Dalwai, who's with Jem Patten in our Cape Town studio. Is this a money problem or is it a people problem, Mohammed?
I would think it's a people problem. It's people on the ground. We need more treatment centers. People can pour money into it, but we need treatment centers on the ground to look at the patients that we pick up from surveillance, the patients that exhibit symptoms. Our treatment centers are full. We're trying to expand as much as we can, but we're hitting capacity in almost all of our treatment centers, and we need more capacity on the ground.
Mohammed Dalwai and Jem Patten from Médecins Sans Frontières, thank you very much for joining us this evening. From Cape Town, they're at the forefront of the battle against Ebola. It's going beyond a humanitarian crisis. Of course, the more than 4,000 deaths on the African continent and a growing number of scares happening on the European continent and in the United States are also raising the global profile of the disease. But without containment on the African continent and with the threats of Ebola screening happening at international airports, and the greater impact happening on global travel, potentially global trade as well, this has far wider ramifications too. Thank you for watching. There'll be more tonight, tomorrow. Till then, good night and goodbye.